Doctor, I know that you've done some research on self-destructive behaviors in physicians and healthcare workers. What can you tell us about that?
We have a questionnaire nurses and physicians and healthcare professionals around different states, and we find that to assume that they are better in terms of behaviors on health is misleading. They have the same exact unhealthy behaviors like people in the general population. So we look at nurses and then compare their behaviors to people in the general population. And at times, nurses and physicians do worse than people in the general population. So we look at core behaviors like physical activity, alcohol use, tobacco use, drug use, sleep problems, and we find that many a times healthcare professionals have more problems than the general population.
Okay. And what are some strategies that practice leaders can use to, push their physicians and staff, away from those?
I think if you look at all the problems that exist with employees in healthcare workforce, many of them are commonly known: poor health behaviors, burnout. And in my world, I think the bottom line, the foundation is that healthcare workers want to do good for other people. The goal of any practice is to make patients healthy. And if that's the goal, then you have to ensure that your workforce is healthy. One. And two, I think many of the problems arise from bad communication. It's like we have bosses in the healthcare field, but not leaders. And there's a difference. Bosses have titles and leaders have the people. And so that's where I think where we should look at training our healthcare professionals who become leaders. In my case too, when you get a PhD or MD, you're trained to do scholarship and teaching and patient care, but you're not really trained to be a leader. And so, there's a chance now for leaders to revamp on their knowledge and skill, improve communication flow between people, among people, ensure that you are taking care of your healthcare workers because they're also human beings and they face the same situations that other people face. We have social pressures, economic pressures, pressures of lack of time. And no matter how much educated we are, we still have the same bad health behaviors. We don't sleep enough. We use alcohol as a coping mechanism. So this is a chance for leaders to improve on their communication, try more technology, interdisciplinary approach, use some administrative skills to make sure that the workflow, the work processes are more efficient, timely, and safe and effective. And it's just a good time for people to rehash their knowledge, revamp their skill, and do some reading on protocols, effective flow of information, good leadership, good management. And don't forget the human side of it. You're dealing with human beings. Even if they're nurses or doctors, eventually they're human beings. And many of them have, life events going on, economic pressures. Like one of my studies looked at job insecurity and workplace harassment. Almost a third of the healthcare workers suffer from job insecurity or they're being harassed in the workplace. And this is not the time to tell everyone that you're adults, go deal with it on your own. This is the time to make your workplaces more disciplined, more organized, clear communication, better flow of information, and use of more technology.